you ever thought how and why human hair grow and shed? In this video we will see about how the hair grows and the reasons for its shedding and the remedies that can be taken. At the end of the video, we will provide a tip to get dense hair, so stay tuned. Now let's start with the human hair growth. The growth of human hair occurs everywhere on the body, except for the soles of the feet, the lips, palms of the hands, some external genital areas, the navel, scar tissue and the eyelids. Hair is a stratified squamous keratinized epithelium made of multi-layered flat cells whose rope-like filaments provide structure and strength to the hair shaft. The protein called keratin makes up hair and stimulates hair growth. The body has different types of hair, including vellus hair and androgenic hair, each with its own type of cellular construction. This varied construction gives the hair unique characteristics, serving specific purposes, mainly warmth and physical protection. On average, the growth rate for human hair is about 1.25 centimeters or 0.5 inches per month, or about 15 centimeters or 6 inches per year. There are 3 stages of hair growth, namely anagen, catagen, and telogen phases. The growth rate of hair varies from individual to individual depending on their gender, age, genetic predisposition and countless environmental factors. The anagen phase is known as the growth phase. This is the phase where the hair physically grows approximately 1 centimeter per month. It begins in the papilla and can last from 3 to 5 years. The span at which the hair remains in this stage of growth is determined by genetics. The longer the hair stays in the anagen phase, the longer it will grow. During this phase, cells neighboring the papilla in a germinative layer divide to produce new hair fibers, and the follicle buries itself into the dermal layer of the skin to nourish the strand. About 85 to 90% of the hairs on one's head are in the anagen phase at any given time. The catagen phase, also known as the transitional phase, lasts about 2 weeks. The hair follicle shrinks due to disintegration and the papilla detaches and rests, cutting the hair strand off from its nourishing blood supply. The first sign of catagen is the cessation of melanin production in the hair bulb and apoptosis of follicular melanocytes. During the telogen or shedding phase, the follicle remains dormant for 1 to 4 months. In this phase, the epidermal cells lining the follicle channel continue to grow as normal and may accumulate around the base of the hair, temporarily anchoring it in place and preserving the hair for its natural purpose without taxing the body's resources needed during the growth phase. At some point, the follicle will begin to grow again, softening the anchor point of the shaft initially. The hair base will break free from the root and the hair will be shed. Within 2 weeks the new hair shaft will begin to emerge once the telogen phase is complete. The process results in normal hair loss known as shedding. Once the cycle is complete, it restarts and a new strand of hair begins to form. Now let's see about hair loss. Alopecia is a hair loss disease that can occur in anyone at any stage of life. It can be divided into 2 types: alopecia areata and traction alopecia. Let's see about alopecia areata. Alopecia areata is an autoimmune disease that causes hair to spontaneously fall out. It is mainly characterized by bald patches on the scalp or other parts of the body and can ultimately cause baldness across the entire body. This disease interferes with the hair growth cycle by causing a follicle to prematurely leave the anagen, or active growth phase and enter the resting or telogen phase. The hair growth in the affected follicles is lessened or stopped completely. Now let's see about traction alopecia. Traction alopecia is caused by adding too much strain on the hair on one's head. Tight ponytails and other styles that require added tension to the hair are often what cause this disease. It can also occur on the face in areas where the hair is often styled. Plucking or waxing one's eyebrows frequently, for example, can yield suppressed hair growth in the area. On the scalp, the hair is usually known to be lost around the hairline, leaving the densest amount of hair at the crown. Small vellus hair will often replace the hair that is lost. Let's see about the remedies we have. There is no cure for alopecia areata, but the hair regrowth can be stimulated with the help of some drugs. It is better to consult a dermatologist in this case. In case of traction alopecia, avoid tight hairstyles if possible, avoid or limit chemicals, including relaxers, change hairstyles every few weeks to prevent strain on one area of the scalp. Try hair growth products. Around 40% of people using a minoxidil product regrow some hair after 3 to 6 months. The United States Food and Drug Administration (FDA) have approved Rogaine, but people should not use it if their scalp is red or inflamed. A professional can work out the cause of hair loss and suggest the best course of treatment. As we mentioned at the beginning of the video, the tip to get a dense hair is to apply fenugreek seeds and egg yolk twice a week. These seeds condition the hair strands, roots and follicles. The yolk nourishes the hair with keratin protein. We can see a wide variety of things such as honey, lemon, yogurt, etc. for hair growth in the internet. They can be mixed with the fenugreek seeds and egg yolk, but in our personal opinion, these two are the primary contributors. If you think you have gained some knowledge, give a like to this video and share this video with your friends and families. And by subscribing our channel, we will be motivated to upload similar videos. Thank you.